Welcome to the Med Center Show. My name is Michael Prelutsky, and I'm the Chief Operating Officer at the Jersey City Medical Center, sitting in for Joe Scott. Joining us today is Dr. Michael Curie, Director of Vascular and Endovascular Surgery at the Jersey City Medical Center. Dr. Curie, thank you for joining us, and welcome.
It's nice to be here.
So to start off, let's talk about you a little bit. Your background, your training, how you came to be at the Jersey City Medical Center.
Sure. So I am a vascular surgeon. I am currently the Chief of Vascular Surgery at Jersey City Medical Center and as well at Rutgers, New Jersey Medical School. And in order to become a vascular surgeon, you have to go through medical school and then 7 years of advanced surgical training, where I completed a general surgery residency at the University of Chicago and then went on to do a fellowship at Washington University in St. Louis. After that, I was on the faculty down at the University of Maryland for a while and then came back home to New Jersey, where I am currently at the medical school and at Jersey City Medical Center.
So when you say you came home to New Jersey, so you're from New Jersey, your family's here?
Correct. I grew up in Essex County. My family is here in New Jersey. My parents are still in New Jersey, and my siblings are all in the New York metro area.
So you go off and train in Chicago, train in St. Louis, and then come to New Jersey to practice medicine.
Yeah, it's nice to be home. I actually went to medical school here in New Jersey, and when I was a medical student, the vascular surgeon who ran the medical school division of vascular surgery was a true giant in academic surgery, one of the leaders in the field, and he was a great mentor to me. And so I learned a lot about surgery and about academic surgery and how to advance the field of surgery from him. And when I started thinking about where I wanted to practice, everything I always did, I compared back to home, to what he had established at the medical school here in New Jersey. And so when the opportunity presented itself, I jumped at it to come home.
So tell us a little bit more about what is vascular surgery.
So vascular surgery is the treatment of diseases of the vessels in the body. So in our body, we have arteries and veins, and the arteries take the blood flow away from the heart and out to the different parts of the body, and the veins bring the blood flow back to the heart and the lungs, where the blood gets oxygenated. And unfortunately, both the arteries and the veins could have various problems with them. And a lot of people are familiar with open heart bypass surgery.
Sure.
And that kind of surgery is to correct the blockages that happen in the heart arteries. There are two arteries that go to the heart. There are a whole lot of other arteries that go to the rest of the body. And the vascular surgeons take care of all the arteries except for the two arteries that are on the heart, and the ones that are inside the skull, which are treated by the neurosurgeons.
Got it. And so what made you want to be a vascular surgeon?
That's a great question. I find vascular surgery to be one of the few specialties where you could be a technician doing the finest reconstructive surgery, but you could also develop long-term relationships with your patients. There are a lot of great surgical specialties, many of which treat a patient for an acute episode, and then they don't really see the patient long-term. In vascular surgery, because our patients typically have diseases that last them their entire life, and we have to manage them, we get the chance to develop long-term relationships with our patients and take care of them over time. If they have a blockage in their leg artery, they may eventually develop a blockage in their carotid artery in their neck, and we could take care of that kind of disease in any part of the body that it may occur. And so I like that about vascular surgery, because I like to have, patient doctor relationships rather than to feel like I am just technically fixing something and then saying goodbye to my patients.
Is there a formative relationship with a patient that really stands out in the last, let's say, 5 years of your career as a vascular surgeon?
Oh yeah, I mean there are lots. I was recently in my office seeing patients with. I had a student with me, and at the end of the office hours, which I saw probably about 15 patients, her comment to me was striking in that she told me, "I was really surprised how many hugs you got," and I found that to be really a refreshing analysis of that kind of, patient-doctor relationship that we have in vascular surgery. And I tend to pride myself on because, these aren't diseases we're treating, these are patients we're treating. And so while it's really cool to be able to fix an aortic aneurysm, and it's technically challenging, and we are able to really affect a person's life, getting to know them as a person and, talking about their grandkids with them or them asking me about my children is something that I really enjoy as well.
And you mentioned the challenging fixing aortic aneurysm. So there are some subspecialties within vascular surgery?
So as a vascular surgeon, there's a lot of different areas that, you could be focusing on. Typically, though, to become a board-certified vascular surgeon, you have to show proficiency in treating all of them, whether it be treating varicose veins, which can be anything from a cosmetic procedure to something that is trying to prevent recurrent wounds related to those varicose veins, all the way up to the most serious stuff like treating thoracoabdominal aortic aneurysms, where the aorta and all the vessels going to all the organs in the body are affected by that. They're both important, for the patient who has it. And so I tend to try to, take care of all the types of patients that have vascular diseases and not just try to focus on one area. There are some people who do become vein specialists. And in our practice, we do have some faculty members who concentrate on veins, some who concentrate on dialysis access. But the majority of us do take care of all different types of vascular problems.
Great. So we're sitting here talking to Dr. Michael Curie, vascular surgery at the Jersey City Medical Center. When we're back, we'll talk about the kind of disease and patients Dr. Curie sees on a day-to-day basis. We'll be right back.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
The Jersey City Medical Center. You know it for its award-winning, life-saving ambulance service. It's also your health hub, with health and wellness locations staffed with certified professionals all through Hudson County. The Jersey City Medical Center, here to help you with your healthy, here when you need us the most. The Jersey City Medical Center. Visit us on the net to learn more. Jersey City Medical Center, Robert Wood Johnson, Barnabas Health Facility. Let's be healthy together.
Hello, welcome back. We're talking to Dr. Michael Curie, vascular surgery at the Jersey City Medical Center. Dr. Curie, let's talk now about the prevention. Let's talk about how one stays out of your office for as long as possible.
Sure. That's real important. And actually, some of the research that we are doing is actually, trying to do exactly that, keep patients from having the need for vascular surgery. But in general, patients develop diseases of the arteries as they age. Unfortunately, we can't control that, right? They develop diseases of the arteries when they have high blood pressure. That is something that is somewhat controllable. And so keeping good control of your blood pressure is really important. Other risk factors for developing arterial disease are smoking. Obviously very controllable, difficult to do, and oftentimes requires some help from primary care and other specialists who treat patients who are challenged with smoking. But if you can stop smoking, it drastically reduces your risk of developing arterial disease. And then the other big risk factor that can be somewhat modifiable is diabetes. Patients who have diabetes and don't control their blood sugar have a much higher risk of developing bad peripheral vascular disease and other end organ pathology than patients who keep good control of their blood sugar. And then the last one is cholesterol and fat content. So what we eat and how well we control our cholesterol is really important. And obviously keeping fit helps prevent vascular disease, cardiovascular disease, and cardiopulmonary disease of the lungs and heart, as well as the arteries in the rest of the body.
So let's say you're following all the prevention stuff, you're staying healthy, but as you mentioned, everybody ages.
Yeah.
So at some point, you're going to see a vascular surgeon. What does one feel? What are the symptoms? What potentially diseases that drive folks to make an appointment with your office?
So one of the most common problems that we see as a vascular surgeon is lower extremity or leg arterial insufficiency. That means not enough circulation getting down to the legs. There are blockages in the arteries. And the way that that most commonly presents is people will have pain in their muscles of the leg when they use the muscles, i.e. walking or running. People typically have a crampy, heavy, painful sensation in the calf muscles when they walk because the muscles can't get enough blood supply to accommodate the additional work that they're doing. When at rest, they're okay, but when they start using those muscles, that's when the muscles are actually starved. And so the way that they usually come and see us is that they tell somebody about those symptoms, usually their primary care doctor, and then the primary care doctor will either send the patient to see us, or they might send the patient to get some vascular testing. And at the medical center, we have a fantastic vascular laboratory, which does the most modern non-invasive tests. By non-invasive, I mean doesn't need any poking with any needles or any sharp instruments. It's using ultrasound testing and other types of testing to check how much blood flow is getting down to the leg, or to look at the blood flow in the carotid artery in the neck and evaluate where the blockages are. Once they have that test, then we are able to give them an idea of what is needed for treatment. So the vascular lab is a real important part of what we do.
So who actually does the testing? Are there qualifications to run a vascular lab?
Yeah, that's a great point. It's real important to get these kind of tests done someplace that is qualified and credentialed. So at the hospital, we have someone with over 20 years experience running our vascular lab, who's really a leader in the Society of Vascular Technicians in the state. And he's really developed a fantastic program there. And the testing is constantly being checked for quality measures and comparing the tests that we do in the lab compared to the more invasive therapies that we provide in the cardiac cath lab or in the angiography suite or even in the operating room. So we find a blockage on a test in the vascular lab, we correlate that with what we see in the operating room or in the angiography, and that's really important.
So how quickly can one find out the results of the test?
Typically, it's right at the time of the test. So the test is done with patients awake. They're interactive, and they could ask questions and learn about what the test is showing.
So if the primary care physician directs the patient to you, and you feel the test is warranted and take the patient to take the test, is there communication back to the primary care physician? How does this whole loop get closed?
Yeah, that's a great point. So primary care physicians or any physician could send their patient directly to the vascular lab, and then the report gets sent back to the ordering physician directly so that they can have that evidence and then determine exactly who they would like to send the patient to for treatment. If they send them to us, then obviously we communicate back after we see the patient as well.
And so vascular surgeons go through special training to interpret the ultrasounds as well?
That's right. That's a special, different certification that's required in order to be reading these types of studies.
So at the Jersey City Medical Center, we have the certified lab and the certified vascular surgeons to interpret the studies and get back to the referring physicians, or even maybe discuss next steps with the patients.
That's correct.
So let's say, unfortunately, the test is positive. There's a finding. What are indeed potentially the next steps?
So that's when we have a conversation with the patient and with the referring physician about what are the various options for treatment. And in general, there are both open surgical therapies and endovascular therapies that are done using catheters and balloons and stents. And as a vascular surgeon, we do both the open surgery and the endovascular therapies, and we're going to work with the patient to find the type of therapy that's going to be best fit for that particular patient, because in one patient, the open surgical therapy might be better, whereas the same problem might be better treated with an endovascular therapy in a different patient for different various reasons.
And how do you determine the best mode of care? Do you talk, is it a patient's choice? Is it a surgeon's choice? How does it work?
So that's why we spend 7 or 8 years doing surgical training to become a board certified vascular surgeon. And then also, obviously, with the experience of treating patients, you get to learn what works well and what doesn't. And it's not something that you can say some particular therapy works well across all patients. It may work well in a particular type of patient who has, small arteries, whereas a patient with big arteries might do better with a different type of therapy. And so those kind of fine details make a big difference in the choices we make about therapy.
When we come back in the next segment, we'll talk about the choices of therapies in greater detail here with Michael Curie, vascular surgery.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. Visit us on the web at barnabashealth.org.
Meineke Car Care, conveniently located at 700 Tunnelly Avenue, Jersey City, half a mile north of County Road. Meineke bumper-to-bumper car care. Brakes, exhaust, oil change, wheel alignments, batteries, CV joints, and so much more. First-rate service at a price you can afford. All major cards accepted. Apply for a Meineke card. Meineke, Jersey City. Stop by and let Sammy check your brakes for free.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to newportng.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. newportnj.com. Newport, live like you want.
Pen & Pencil Properties, Jersey City. Shaping the workplace with state-of-the-art office spaces that address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at penandpencilproperties.com. Pen & Pencil Properties, building Jersey City for everyone.
Welcome back. We're sitting here talking to Dr. Michael Curie, Director of Vascular and Endovascular Surgery at the Jersey City Medical Center. So, Dr. Curie, we talked in the last segment about diagnosis of disease. And so what happens if, unfortunately, there's a positive result? What modalities, what treatments do we have at the Jersey City Medical Center?
Sure. So at Jersey City Medical Center, we're providing all the standard care for patients with any type of vascular problem and some of the really new and advanced modalities as well. Patients who have an abdominal aortic aneurysm, which used to be treated by opening the patient and doing a major abdominal surgery.
When you say opening, meaning a full surgical
Full from
opening?
stem to stern, all the way down, open up the body, and then replace that segment of the aorta with a graft that we sewed in. We now are doing most of those cases using endovascular therapy. And we put in a graft from the inside going from the groin.
And when you say endovascular and graft, and again, I'm just trying to explain to our audience here. So endovascular means what?
Means instead of fixing it from the outside of the artery, we're actually fixing it from the inside of the artery.
And how do you get there?
So we go in through the groin, through just a needle poke in the artery, and we start passing our wires and then catheters in through that groin artery, and we're able to access the aorta in the belly. And then we could take pictures doing an angiogram, find exactly where the aneurysm is, and then seal the aneurysm using a aortic stent graft. And I actually happen to have a couple of these devices here today where we put these devices inside of patients through a catheter that is smaller than my pinky.
So
it's about the size of a pencil.
It looks bigger than a pinky.
That's right. So this is typically collapsed all the way down inside the catheter. It's folded up inside the catheter. And you can see I have a couple, different types of devices here where the devices come inside the catheter, and then we unsheath them, and it opens up into this configuration. And you can see inside is, the blood flow runs inside the graft and then comes out into each of these legs, going to the leg arteries. And, it's really important to understand the technology, how it's working, and what are the changes with time to these types of technology. And we've been involved in research and clinical trials where we're trying to advance the field. And if you find, some of these older devices, they're very stiff and they don't bend well. And some of the newer devices, they take the bends inside the arteries really well. And so it's really important to be on the cutting edge, using the best therapy for any particular patient rather than what has just always been used in the past. And, as the faculty of the medical school, we're involved in the clinical trials that advance these kind of technologies on a regular basis.
And so these stents, do they last forever? Do they last for 1 year? How long is it effective?
They last forever, and they
Wow.
stay inside the patient for the rest of the patient's life.
And when you go through the airport checking, does it go off, or is it
No. These devices don't set off any alarms. You can actually have a CAT scan or an MRI with them. The technology is really pretty amazing, how well it works. And we're able to apply this technology to more and more patients these days than ever before, and in a less invasive way. Previously, we used to make small incisions in the groins to get these devices in there, and the devices were on bigger catheters. They've been getting smaller and smaller, and now we actually just use a needle poke and do it what's called percutaneously, so that the patients really have almost no scars or incisions, and they've gotten their aorta fixed.
And how long is this stay in the hospital? It sounds like it should be just in and out. It's amazing.
Yeah, that is the amazing thing. So when we used to treat these patients with open surgery, they would typically spend a week to 2 weeks in the hospital. Now the patients typically leave the next day.
Wow.
Yeah, it's amazing.
So the famous hospital food is only for one day.
That's right.
And where do you do these procedures usually?
These are done in the operating room, and we have specialized equipment for doing the angiography, where we can actually see inside the vessels by injecting some dye and taking X-ray pictures. But we could also even go inside the artery with an ultrasound and look at the vessels from the inside as well.
Wow. And so is the future this being just an outpatient procedure? What's on the horizon here?
You know, that's certainly a possibility that we may have these kind of procedures being done on an outpatient basis. I don't think we're there. And, you know, I think when people start doing some of these things and pushing the boundaries, we do see some issues arise. And while we are very much forward-thinking and cutting edge, you know, patient safety comes first. And, you know, one night in the hospital, you know, it's a pretty amazing to see these things get fixed and spend 24 hours in the hospital compared to what used to happen for these patients.
And certainly Jersey City Medical Center is known for its safety, for its quality. We are a magnet institution. We are an A-rated leapfrog hospital 12 times in a row.
Yeah, that's one of the things that makes us feel so comfortable doing these complex cases at Jersey City Medical Center. The post-operative care in the intensive care units and out on the floors really is amazing, and it leaves us a great comfort knowing that our patients are in good hands. One of the other great advances that, you know, we've made at Jersey City over the past 2 years is that we now actually have a full-fledged vascular fellowship training program at Jersey City Medical Center. The very few community hospitals can claim that, where we have a fellow who's already, you know, board eligible in general surgery and doing specialized training in vascular surgery in the hospital all the time. It really adds a level of confidence, you know, knowing that that kind of expertise is always there for any issue that comes up.
So it's great to hear that the Jersey City Medical Center is really at the highest level of vascular surgery. It's safe, it's high quality. We certainly have great doctors. It's a team effort, nursing and technologists doing vascular imaging and the fellow. It's a wonderful program.
Yeah, it's really something that we're quite proud of.
Well, I appreciate you coming to the show. Thank you for your time. And this has been Vascular Surgery at the Jersey City Medical Center with Dr. Michael Curie. Thank you for joining us.
Such as a cardiac ultrasound, looking at the way their heart is pumping, looking at the way their valves are functioning. We also go deeper and using tools such as stress testing to see patients sometimes may not feel chest pain because they don't do the amount of physical activity required to bring about the symptoms. But stress testing is a nice way for us to see if there's any micro changes that occur, whether it's a problem with circulation or whether it's a problem with irregular heartbeats and whatnot, to try to identify if these patients are at higher risk and need early treatment.
And so here you are sitting next to Dr. Kraus, members of a team for the Heart Center. So how does it work where the patient needs to make a transition from cardiology to cardiac surgery?
That's a great question. I think that if you look at historically, specialties were sort of segregated from primary care. And what I feel that the modern era of medicine, it's not surprising. I mean, we welcome specialists such as cardiothoracic surgeons, vascular specialists, and we try to have a multidisciplinary approach. We know that medical therapy has evolved over the years, but what we want to do is bring about all specialists together and make the right decision to give the patient the best outcome.
So when we come back, we'll talk about this teamwork approach. We'll hear from Dr. Kraus. But in the meantime, we'll be right back.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
The Jersey City Medical Center. You know it for its award-winning, life-saving ambulance service. It's also your health hub, with health and wellness locations staffed with certified professionals all through Hudson County. The Jersey City Medical Center, here to help you with your healthy, here when you need us the most. The Jersey City Medical Center. Visit us on the net to learn more. Jersey City Medical Center, Robert Wood Johnson, Barnabas Health Facility. Let's be healthy together. It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. Visit us on the web at barnabashealth.org.
Welcome back. We're sitting here with Dr. Kraus, Dr. Godwin, talking about the Heart Center at Jersey City Medical Center and what the patient should expect should they need our services. So we finished last segment talking about teamwork and transition from cardiology to heart surgery. So Dr. Kraus, what does it look like from your perspective?
Well, I think it's changed a lot in the last 25 years, but I think teamwork, as Dr. Godwin had mentioned in the first segment, is so important in cardiac treatment. The treatment begins with medications, and then it progresses to perhaps an interventional or at least a diagnostic study to determine if there is a coronary artery problem, for example, or a valvular problem. Quite often, those problems can be dealt with medically. As a matter of fact, most of them can be. And then ultimately, and Dr. Godby will talk about this, about the interventional part of fixing particular valvular problems or fixing particular coronary problems. But we especially work close when he comes across a problem that he can't fix. And that's when he'll give the cardiac surgeon a call. And we'll get involved with perhaps discussing, or we have our meetings where we have joint effort put in by either the cardiologist, other ancillary care personnel, myself included, where we'll discuss the pros and cons, the risks and benefits to the patient. We include the patient in the decision. Some patients will not want surgery at all costs, and we have to deal with that. But we have a comprehensive center at Jersey City Medical Center. We have excellent nursing with the Magnet Award as long as I've been there, and Leapfrog. So I think all aspects of care at Jersey City is taken care of.
So as you mentioned, heart surgery, or certainly heart care, is a team sport. It takes cardiology, it takes cardiac surgery, but as you mentioned, it also takes nursing. And yes, we do have a magnet status at the Jersey City Medical Center. It takes quality, safety, and training. And we have a rating from Leapfrog at the Jersey City Medical Center for the last 12 rating periods.
Right.
I think under 60 hospitals in the country out of 3,000 can say that. So certainly, what do you tell your patients when they come to see you and now their life literally is in your hands? How do you make them at ease? How do you prepare them for surgery?
Well, you know, one of the biggest things that is on their mind, not so much, well, certainly the technical ability of the surgeons. They always check everyone out online, and it's easily done. We have a report card, which is put out every year with all of our data on the report card. So, and we have an excellent record, the surgeons at Jersey City. But also, they want to know about what you just mentioned, the ancillary care, the aftercare. Because you could do a perfect operation and you want things to go well post-operatively. And what's included in the comprehensive care is the cardiologist seeing the patient every day, multiple times a day, the nursing who are specialized in open heart exclusively, intensive care.
So the nurses, I'm sorry to interrupt, are specially trained for open heart surgery.
Correct.
And work in a special unit in the hospital that takes care only of open heart patients.
Right. There's a designated area with designated nurses that just do that. And it's a whole team from anesthesia who are fellowship trained in cardiac surgery. We have 4 members that only work with us in cardiac surgery. And the nursing in the operating room also are specially trained for open heart. So when we say comprehensive, right from even to the rehab, the disposition of a patient after surgery. Some patients opt to get a little extra physical therapy before going home, and we would set that up immediately after surgery to facilitate their rehabilitation.
And so, Dr. Godby, as Dr. Krause just mentioned, so you actually don't leave your patient. You still go see the patient in the hospital every day?
Absolutely. We see these patients, you know, we've known these patients before surgery. We send them through the process of getting evaluated for surgery, and then we're seeing them each and every day during their surgery up until discharge, and then we see them back in the offices again.
And so what kind of rehabilitation services take place after discharge from the hospital?
So many times these patients go through numerous pathways. Some patients are well enough to be discharged to home directly. Some patients require the need for ancillary services such as subacute rehab or transitional rehabilitation. Some patients need cardiac rehab to improve their performance levels before they're ready to be discharged. Some patients need a combination of cardiac and neuro or pulmonary rehab but we have all ancillary facilities available, and we have colleagues that work in these facilities so we can help the patients transition to these individual areas.
So our goal for this transition is to send the patient home and do the rehab at home, not necessarily in an institutional setting?
Well, I mean, studies have suggested that some patients with cardiac disease do benefit from cardiac rehab. So it's not always a means of trying to get the patient home, but it's trying to offer the best standard of care to allow them to have the best outcomes.
That's great. So Jersey City is one of the most diverse cities in the country.
Absolutely. That's one of the reasons that drew me into practicing in this area. We have a very, very diverse ethnic population. And as I talked about in my first segment, risk factors for coronary artery disease, what we're seeing is that over time, the number of acute heart attacks, and what I mean by heart attacks that completely block the artery, we're doing well with reducing those, but we've started to pick up on other minor or secondary heart attacks, which be it because of advanced technique, advanced diagnosis, early point-of-care testing that we have at the medical center. But at the same time, what we're seeing is that there are individual populations that have intrinsic risks that are above and beyond these traditional risk factors. And that is what Jersey City is about. So recognizing the cultural variances is very important. And I think that our colleagues here are well trained, and we communicate well enough and educate ourselves in recognizing what we need to do for these individual populations.
And Dr. Krause, how does it affect your practice, these cultural differences?
It doesn't, because we have so much help at the hospital, whether it be interpreters, cultural interpreters, all sorts of different ways of dealing with these cultural differences. And they've had so much experience with it at Jersey City Medical Center. It's not something that's a new phenomenon. They've had decades of experience with it.
And
so, I'm sorry.
No, as Dr. Krause was pointing out, I think that the important thing is that we want to improve outcomes. We want to improve quality, but I think at the same time we want to make sure that the patients are confident in that we have given them all the options. And that is what the comprehensive approach is about, and that is why we're proud to be in a situation in which we can communicate and offer the patients what they really truly deserve.
Great care, safe, quality, great care.
Absolutely.
And we'll be right back with the next segment.
Meineke Car Care, conveniently located at 700 Tunnelly Avenue, Jersey City, half a mile north of County Road. Meineke bumper-to-bumper car care. Brakes, exhaust, oil change, wheel alignments, batteries, CV joints, and so much more. First-rate service at a price you can afford. All major cards accepted. Apply for a Meineke card. Meineke, Jersey City. Stop by and let Sammy check your brakes for free.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport. Live like you want.
Pan & Pinto Properties, Jersey City. Shaping the workplace with state-of-the-art office spaces that address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panandpintoproperties.com. Pan & Pinto Properties, building Jersey City for everyone.
And welcome back. We are here again with Dr. Krause, Dr. Godwin, members of the Heart Center at the Jersey City Medical Center. We'll talk now about some high-end procedures that are available at the center and what the future holds for heart and vascular disease. So, Dr. Godwin, let's start with you. So, the Jersey City Medical Center is currently replacing one of its cath labs. That's a multi-million-dollar investment in the future of care at the Heart Center. Talk to us a little bit about what happens in the cath lab and what future holds there.
Sure. Well, we've come a long way. In the past 50 years, the first angioplasty, which is the balloon, using a balloon to open up the artery, occurred back in 1977.
In Kansas City? Or?
Well, it was done simultaneously. The first one was done at Lenox Hill, where I trained.
Yeah.
The other one was in San Francisco in St. Mary's. But since then, 50 years later, we are at the forefront of continued innovation. In our cath lab in particular, we have our fourth generation of stents, the drug-coated stents, which is the fourth generation, which are thinner.
And I'm sorry to interrupt, and a stent is?
So the first angioplasty was done in 1977, and since then, a simple balloon to open up the artery, we felt and we knew from data and outcomes that wasn't enough. So then they made a metal stent, which is actually a metal spring-like device that we insert into the arteries to keep that artery open. Since then, we realized that that was not enough. So we went with a special drug coating on the stents to prevent that artery from developing an inflammatory response. So since the first drug-eluting stent, now we have fourth-generation stents that are thinner, easier to deliver, and allowing us to do more and more complex cases where we see the gray zone between which will require surgery and which will require angiographic procedures and intervention. We use intravascular ultrasound, which is not just ultrasound of the heart, but we can go in with angioscopes and actually image the inside of the artery to determine the composition of plaque. We have special tools that we use to measure the pressure differences between arteries and between blockages in the arteries.
And why is that important to?
It's very important because it allows us to see that if there is a lesion that needs to be truly treated or not, this can kind of help us differentiate which patients and select the patients that actually will benefit from a stent rather than putting in a stent just blindly when you see these lesions. And many of these arteries that have negative FFR can often be treated with medications and avoid stents.
Negative FFR for our audience?
FFR would be the pressure. If the pressure difference is not significant, then a stent may not be required.
And is there a fifth, sixth generation stent
they're
coming down the pipe?
They're coming. I think we now recently have started to see smaller and smaller stents, which in the past we were not able to treat certain arteries because of the small size. The minimum stent was as much as 2.25 millimeters. Now we're seeing stents coming out in the near future to be 2 millimeters in length.
And I'm reading, I'm sorry to interrupt, and I'm reading some stents will dissolve.
Absolutely. What we would like to see is that rather than leaving foreign body inside the artery, we want to see if we can actually open up that artery for a period of time, treat with the special material, and then have that stent resorb itself. So the bioabsorbable stents have shown promise, and they're coming. There are certain areas where we need to treat the artery, but they have side branches that we don't want to pinch or close, and bifurcation stents are also in the upcoming future, which are actually being used as we speak, and these will allow us to treat more and more complex vessels.
And all this is and will be available at the Jersey City Medical Center?
Majority of it is already available at Medical Center, and the new devices are soon to be coming within the next few years.
That's wonderful. So, Dr. Krause,
Yes.
what's coming up for cardiac surgery? Right now, I see some patients when I round that have large openings in their chest. They're sitting there with their red pillows. What's the future holding?
Well, I think just to repeat, we do all aspects of heart surgery. So we do coronary bypass, we do complex coronary bypass, but we also do off-pump. Many of our patients ask about that.
And when you say off-pump, can you explain that a little bit?
Yes, off-pump is ordinarily the heart-lung machine is what we use to do the bypass to keep the heart still and bloodless. And we've developed techniques over the last 20 years to, at selected patients, not go on bypass to minimize some of the inflammatory effects, some of the complications related to the heart-lung machine. So that's so we offer the off pump. We offer conventional valve surgery, complex or reoperations. But we also, as you mentioned just now with the pillow, instead of having an incision like this on your chest, you can have a 7-centimeter incision, which is about 2 inches. And we actually measure 7 centimeters when we make the incision. And we do it either on the side or in the midline. And that's for aortic valve or the mitral valve. And then a little further down the pike, but also we've done all aspects of aneurysm surgery. So if you have a complex or even just a simple aneurysm, an aneurysm again is a dilatation of the main artery of the aorta.
It's expansion of the artery.
It's an expansion of it, and once it reaches a certain size, it could spontaneously rupture. So if you have an aneurysm, we have a comprehensive clinic that could evaluate any aneurysm, and we follow you periodically. And then last, we have a TAVR clinic. As you probably heard about the percutaneous valve placement, we don't do the valve placement ourselves just yet, but we do it at another institution. But we have a screening program so that we could selectively look at any patient and decide whether they need.
And TAVR stands for, again, this is for
It's
our audience.
a transcutaneous aortic valve replacement. So TAVR, transcutaneous aortic valve replacement.
And this is a minimally invasive procedure.
Well, it's super minimally invasive because you don't even make an incision on the chest at all. It's all done in the cath lab through a catheter, as if you're getting an angioplasty or a catheterization.
So any Jersey City or Bayonne or any neighborhood patient who may need this procedure can come to us in Jersey City Medical Center to where we'll advise, we'll screen appropriately, and we'll prep that patient, and then the rehab can be back next to their home.
Absolutely.
That's great. Well, I certainly appreciate you guys joining us today.
Thank you.
Thank you for taking the time.
Sure.
We spent some segments learning about the Heart Center at the Jersey City Medical Center. Dr. Krause, Dr. Godwin, everything they do for us at the medical center and for this community. Again, thank you for joining us, and that's a wrap.